Just ahead on Being Well, we'll talk about diabetes and what you need to know to both prevent and treat the disease. My guests are registered dietitian Jan Coombs and RN Lisa Cornwell from the Paris Community Hospital Family Medical Center, so don't go away. Well, ladies, thanks for coming on Being Well. We're talking about a very important topic today, and that's diabetes. And we want to get everybody up to speed on what the disease is, how to prevent it, and if you have it, how to manage it. But let's first start talking about, tell us, what is diabetes exactly?
Diabetes is an endocrine disorder. First of all, your body needs energy to do its day-to-day functions. You get that energy from eating foods. When you eat these foods, especially carbohydrates, your body breaks them down into glucose. It goes into your bloodstream. And in order to get the glucose from your bloodstream into the cells to provide energy, you have to have insulin. And that is a hormone produced by your pancreas. Insulin is basically the key that unlocks the door to the cells. When you have diabetes, when you first get it, if you're a type 2 diabetic, your cells become resistant to the insulin. Therefore, your glucose can't get into the cells to provide energy, and that's where you get your high blood glucose. Eventually, as the disease progresses, or if you're a type 1 diabetic, your pancreas stops producing insulin altogether, and that's when you have to do like the insulin shots to treat that.
So why is it, what does it do to the body if you have diabetes? Why is it so hard on your body and your system?
High blood glucose over time has many complications. It damages the small blood vessels in your body, especially in your eyes. You can develop retinopathy that eventually leads to blindness. Neuropathy in your feet and your legs, loss of sensation, can lead to amputation. Kidney damage, eventually leads you to kidney dialysis and or transplant, and eventually death if you don't take care of yourself.
So a lot of things, it may sound like a simple disease if you're diagnosed with it, but it can get complicated as time goes on.
Absolutely.
Let's talk about some of the people out there who are at risk for getting it. You talk about some of the risk factors.
Obesity is one of the major ones. People who have been gestational during their pregnancy and maybe had to go and use insulin during that 9-month time, they are more prone to becoming diabetic after their children are a little bit older.
Other risk factors?
Genetics plays a huge role. If you have a sibling or a parent who has diabetes, that puts you at increased risk. Also sedentary lifestyle.
Yes.
And we had talked earlier about you had talked about numbers. It's really astonishing how many people have it or are going to get it. Can you talk about that? Share
Absolutely. Currently here in the United States, there's roughly 26 million people who have the diagnosis of diabetes. Of those 26 million, 7 million people have it and don't even know they have it yet. Every 24 hours, there are 4,100 new cases of diabetes diagnosed, and it's a growing epidemic.
So what can we do before we start talking about if you have it? What can we do now to prevent it in the first place?
Eating right.
Well, what's really interesting, when you go in to see the doctor for a routine visit, oftentimes now they will take blood work, and we are now trying to reach people at that stage we call pre-diabetes so that we can help them even more earlier on so the damage will not be as progressed as quickly.
Well, we started talking about, we do pre-hypertension numbers now. They're starting to test for pre-diabetes. What are we know, we talk about high blood pressure numbers. What are the numbers for blood sugar? What's normal, what's pre-diabetes, and what's diabetes?
70 to 100 is what we hope everybody's at. When we see it go to, what are we looking at now, 120? We are full-blown diabetic at that point.
101 to 125 is pre-diabetic, and then anything over 126 or greater on 2 or more occasions is considered diabetic.
Okay. Now we often hear that there's a connection between diabetes and heart disease. Can you explain why those two are so connected?
Absolutely. When you have diabetes, it increases your risk for the cardiovascular disease, heart attack, and stroke. One major reason that is because when you have high blood glucose in your blood vessels, over time that damages the lining of the arteries in your blood vessels. Therefore, it's easier for the plaque to build up, such as cholesterol. And when we know when cholesterol builds up in our arteries, it causes heart attack and stroke.
Will a majority of people who have diabetes have heart problems as well?
If you don't take care of yourself. The key there is exercising and eating right.
And what we find over time is that blood pressure issues, cardiovascular problems, and diabetes kind of walk hand in hand. And if you can work with one and get it under control, you can help work those other two into not getting worse at the speed that they might accelerate at otherwise.
Okay. You had mentioned earlier that type 1 and type 2. Can you clarify for our viewers what's the difference between type 1 and type 2 diabetes?
Sure. Type 1 diabetes, it used to be more referred to as juvenile diabetes. When our younger population, our children, get diabetes, typically it's type 1. Young adults can be diagnosed as type 1 too, but what type 1 is basically your pancreas does not produce any insulin whatsoever. Therefore, you have to do the multiple daily insulin injections and or an insulin pump. Type 2 happens in our obese adult population most often, and it's where your body produces insulin, but your cells become resistant to it for one, and then two, over time you can actually stop making insulin. Type 2 diabetes is happening more and more in our overweight children population.
Yeah, that's what I was going to talk about, that it's happening. You're probably seeing younger patients more and more.
It is definitely a growing epidemic with our younger overweight children.
Grade school, junior high, high school. And they often show with elevated blood pressures. They may even have elevated cholesterol levels, which is reflective of possibly the diet that they're consuming when they utilize the fast food restaurants as much as they do.
So let's talk a little bit about, there are some signs for diabetes. Can you talk about those?
Yes, signs are being extra thirsty, frequent urination, extreme fatigue, unusual weight loss, blurry vision. There are several signs that, signs and symptoms that go into it, but many Americans don't have any signs or symptoms at all. And that's not uncommon. That's why there's 7 million walking around who don't know that they're diabetic, because they don't have these signs and symptoms.
How much does your chance of getting diabetes increase if it's a family history? Do you have any idea of, predisposition to it?
I would say there is an elevated risk for it. And oftentimes we'll see people who are type 2 diabetics who will have a younger sibling, or maybe a mother or a grandmother or grandfather. It doesn't discriminate. Everybody seems to be open to the possibility. And some of them just realize that over time it's likely going to happen to them. And some of them are more accepting of it than others, but it is something that does go through families pretty much all the time. We see it.
Let's talk about accepting or not accepting. Do you see people that just are in denial about it, or just think, oh, it's not that bad. I can take some insulin, I can take a pill, it'll be fine?
Well, unfortunately, that's something that we see quite often. A lot of the times, the people who accept it and embrace it and realize that there's something they can do about it, those are the patients that we work with that generally do very well. And they will be able to monitor their blood sugars over time and keep them in check and do the right thing by themselves. So there is a way to adapt to a healthier lifestyle. And we do see it.
We do see it.
And we're
quite
very
often.
excited when we see it.
Well, that brings my next question. Let's talk about managing diabetes. If you have it, give our viewers some tips on what they can do to better manage their diabetes.
First of all, it's going to be eating healthy, eating a well-balanced diet. 2 is exercise, get moving. Recommendations are 30 minutes most days of the week. And just diet and exercise alone and maintaining a healthy weight and a healthy body mass index will greatly reduce your risk and help manage if you already have the disease.
And it's important to let people know that they can do housework, and it counts. Doing washing windows, vacuuming, keeping active, burning calories is really the heart of that issue of activity. And of course, we would love everybody to get on a treadmill, but that isn't always the case. And even people who live in a multi-storied house, they could do stairs, make purposeful trips up and down the stairs to do things, and that's a part of keeping the calorie burn going, which is what we're trying to do.
That's right. Well, speaking of calories and food, you brought some things together today. Can you explain your demonstration for us?
Well, probably the most important thing for patients to realize is that the fuel source that provides them with energy is carbohydrate based. And most people will come in to Lisa and myself and they will wonder about completely giving up carbohydrates, which is an erroneous idea because carbohydrates are the fuel. What patients need to learn over time is that the type of carbohydrate is what's really, really important. And the more nutrient dense those carbohydrates are, the more they are complete in their nature with the fiber intact and more closely attuned to where they came from in their growth cycle as garden vegetables or starches. Those are healthier carbohydrates and they're essential to everyone's life. So leaving the refined sweets, the things that we think of as the snacky foods, those are things that if people can put those aside, they can be worked into a daily diet in small amounts, but the power of their carbohydrate is so strong that it actually works against their blood sugar numbers on a daily basis.
So for diabetics, when you look at food labels, carbohydrates, that's probably the most important thing to look at?
And it's a dovetailing thing because we see people having all the different aspects, the blood pressure issues and the cardiac problems, we know that people need to keep their proteins lean, and we know that they need to be looking at fats that are the healthy ones as opposed to the ones that are hydrogenated that come in a lot of processed foods. So if they can look at those two components of the macronutrients and then get into gear with the right kind of carbohydrates, they're going to be successful.
So in this plate you have some things to show us to compare carbohydrates. Why don't you go through that?
Absolutely. Lisa and I both work with calorie levels, and that's unique to patients. And so once we realize that a patient needs to start watching their calories and carbs, we can determine how many carbs they're after on a daily basis. And just the aspects of looking at food as you see it here, there's a reason I put everything in a measuring cup because measuring is really important.
Portion sizing.
I like to liken this to gasoline going into a car, that people know exactly how much fuel is entering their gas tank before they leave the gas pump. If you know how much carbohydrate is going into your tank, you can better realize how you're going to function. And so when you look at vegetables, as you see here, these are each worth about 5 grams of carb apiece. The slice of bread is worth about 15. So if I see 3 different servings of vegetables, which I'm really keen on having people eat because they are an intact nutrient, they're going to get as much blood sugar expression from this slice of whole grain bread, 15 grams of carb, as they will from those 3 vegetable servings.
So if you're interested in volume of food, these vegetables are going to give you a lot more volume, make you feel a lot more full than the 1 piece of bread.
Absolutely.
But the bread isn't a bad thing.
The bread is not a bad thing. And people come in and they're worried about whether they should eat pasta anymore. And it's actually a matter of amounts. And by learning what those carbohydrate amounts are that are appropriate, they can make the choices themselves, how they put those into their system.
So for diabetics, I know it's probably different for everybody. Is there a recommended number of grams of carbohydrates that they should shoot for every day?
Absolutely. It's based on their weight and their age and their activity level as well. So the more active they are, the more they can justify eating more carbs, which is kind of a nice thing. When you're looking at poundage, the average woman, middle-aged, probably can tolerate about 1,500 calories a day. Her carb needs at that point are about 60 to 65 grams of carb per meal.
Okay.
And that's allowing 3 meals a day plus a snack before bedtime,
Okay.
which we do recommend.
Which really, for people who don't have diabetes, that's probably not a bad plan to follow anyway.
It's
So,
not a bad plan
if
to
you
follow.
if you're in a family where maybe your spouse has diabetes, it's really not a bad eating plan for anybody.
You're really hitting it on the head, my dear. Because we do find that if people in a lifestyle situation will allow their family members to be active participants, everybody gets healthier.
Yeah.
And it's really much more positive for the person who has to watch what they're doing.
Well, let's talk a little bit, continuing on food. There's certainly a lot of sugar-free substitutes out there. Is that a free food for diabetics because it doesn't have sugar in it?
That's really a very interesting question, and I'm glad you bring it up. When we're looking at how the body utilizes carbohydrates and nutrients, what we find is that the clean burning fuels are the really, really good nutrient-dense ones. When people are adding artificial sweeteners into their diet, and it might come through pop, it might come through a diet pudding or a gelatin, it might be in sugar-free pie.
Right.
What people need to do is learn to determine the carbohydrate content of a food, because just because it says sugar-free and may have artificial sweeteners in it, it may not in fact be carbohydrate-free because of the other components of macronutrients in that product. Do you want to add to that?
No, I think you did a great job. A lot of people do think, though, as they come in to talk to me, well, I ate this and it's sugar-free. And we always have to correct them and make sure that they understand, like Jan said, it's not carbohydrate-free.
Right.
And that's what
I mean,
you have
if you
to
think
watch.
about sugar-free pie, the crust has a lot of carbohydrates
Well,
in it.
and the
so-
fact that the fillings may have a dairy product in them if it's a cream pie. So it's something that with their level of understanding becoming proficient, they become more adept at making those choices. And we learn strategies and we teach strategies to help them make those little tweaky moves that are going to make this much more appropriate for what their needs are down the road.
Right. All right, well, let's talk about blood glucose meters, because there's several styles and models available, and it's an important part of every diabetic's life.
When you're diabetic, it is very important to test your blood sugar, depending on what stage you are in the diagnosis and what medication or treatment you're taking. People normally test anywhere from once a day to 4 times a day. These are some examples of the glucose meters, and they work by putting one of these strips that match your meter in. You have a lancet that draws the blood from your finger, and basically it tells you right then and there within a few seconds what your blood glucose is. Basically all these models here do the exact same function. It just depending on insurance coverage, which one is going to be the cheapest route for you.
And the technology, if you've been a diabetic for a long time, technology always gets better and it makes it easier.
It does. And these actually, most of them come with a cable that we can hook up to our computer, and it actually prints out trends, graphs, so we can see over time what your blood glucose is doing.
So even if, and I know there's probably no such thing as mild diabetes. If you're diagnosed right away, you need one of these, correct? And it's
Yes.
something you need to test every day.
Yes, from the time they find out that you're diabetic, that your levels are too high, you need to be watching it, you need to be testing.
So there's no such thing as, oh, I have a little diabetes. You either have it or you don't.
That's correct. You're right.
And a lot of people think that I just have a slight case of it, or I have a touch of sugar is what they refer to it as. But you're either non-diabetic, pre-diabetic, or you're diabetic.
But not everybody needs insulin.
Correct.
Correct. Let's talk about the different stages that you can go through. You can control it with diet, first and
You know,
foremost.
early on, most of the physicians will try people with diet, and a lot of times it has to do with the patient's eagerness. Can I try this with my diet?
Right.
And of course, that is a piece of it. Your emotional aspects of life play into it, and so does your physical activity. So it's not just the food, but the food is a big part of it. So for a while, we can get by with the food, but then oral medications often appear, and Lisa, why don't you talk about the metformin? Everybody goes on metformin first.
When diet and exercise quits working and quits controlling your sugars, the first, or the next line of defense, I should say, is a pill called metformin. And what metformin does is basically make your cells more susceptible, less resistant to the glucose and the insulin that is in your body already. That's the next line of defense. People often continue on metformin even when they progress onto insulin, just because it helps them use less insulin.
Okay.
There are other oral medications to help treat diabetes, or help control, I should say, instead of treat, help control diabetes when the metformin quits working. And then when you go through the metformin, the other oral medications, then comes the Lantus, and or comes the insulin. And you have Lantus, which is a long-term basal acting insulin, and then you have your mealtime insulin as well.
Okay, and you brought with you an insulin pen, which is something new.
I did. It used to be when you were on insulin, you had to have the vial of insulin and a syringe with a needle. As you said, technology is always changing, and now you can get your insulin in a pen. And you know, this can stay at room temperature. You throw it in your purse. It's very easy just to dial up your dose, and then, you know, the needle on this is much littler than the old syringe and needle that we used to use.
I mean,
So
when you held it up before, I could hardly see the needle.
Yes.
It's very, very small.
Yes, and when somebody becomes a diabetic, and as I'm discussing the progression of the disease and the progression steps of treatment, I always get this out because it calms a lot of fears, because they're used to the syringe and big needle, and when I hold this up and they can hardly see it, then it kind of calms their fears a little bit. But very convenient, very easy to use.
So that's good to know. Let's talk about, and we've got about 4 minutes left. You know, people, if they're diagnosed with it, it's got to be a very frightening. You know, you're thinking about long term. You got to change your lifestyle. Give people out there some advice or some tips for, you know, how they can manage this disease and live a long and healthy life.
Well, the first thing I would recommend is become knowledgeable, learn all you can about the disease, and utilize the team members, including your doctor, our nurse educator, and myself, dietitian. We really do enjoy becoming team members with the patient and their caregiver, and getting everybody into regular appointments so that they have a chance to really ask questions and follow through on it makes them feel more confident with going through with the practice of controlling it.
Depression also is a big factor with diabetes. A lot of people with diabetes have depression just because it gets frustrating and they feel down, you know, dealing with this disease. So talking about that, if you have feelings of depression and feeling down, definitely talking to your physician, getting help with that, diabetic support groups. There's even diabetic support groups online to help just talk and kind of vent your frustrations that go along with the disease to other people who are experiencing the same.
And what about for family members or spouses, you know, children of diabetics? What can they do to help, you know, mom or dad who has it or a sibling?
I think one of the features of working as we do in Paris at the hospital and at the clinic, we invite family members to attend with the patient. And that's really a big part of it, is to let them all learn as mom or dad or brother or sister go through the process of understanding it themselves. That just gives them an insight as to what's going on. Having them help in the kitchen, I find, is valuable. Having them go grocery shopping and all look around for what's the carbohydrate content in some of the foods that we enjoy. Let's see what we can fit in. Because everybody's got pizza night. Everybody wants to, you know, keep things normal, but they need to learn how to strategize those family times.
Just be supportive, help them get motivated, suggest, say, hey mom, hey dad, I want to go for a walk, will you go with me? Helping them get motivated and active, and just being supportive all the way around.
So with proper management, this is something that people can live a long and active life with. I mean, it's a scary disease.
Scary.
Very scary, very frightening, but with the help of family members and people like you, people should be able to live the life that they intended to.
On one of the seasons of The Amazing Race, there was a contestant who was a type 1 diabetic.
Yes.
Has been since she was real little, on an insulin pump. They won. They
Really?
won the Amazing
Yes.
Race.
Yes.
And you know, I've had the great pleasure of hearing her speak and talking about her challenge, and they didn't give her any special treatment. So if, you know, if somebody can win the amazing race being a diabetic and being on an insulin pump, diabetics can do anything.
Well, I'm a cyclist, and one of the gentlemen that I bike with is a type 1 diabetic, and he can beat us all up the hill anytime. He's an amazing athlete.
Absolutely.
And, you know, just takes really good care of himself and, you know, eats right and exercises, and he's, you know,
And
like
that is the
just
key.
keeping it all in check so that you can continue to live life like you want.
To its fullest.
That's right. Well, thank you both for coming on and sharing such good information with us today.
I'm
Appreciate
glad
it.
to.
Thank
Thank you.